Hello everybody and welcome. Thank you so much for joining us here at this special webinar that we're hosting today. It's on the subject of the role of digital identity in the healthcare services transformation. Please feel free to tweet any sound bites that are interesting to you as we go through the next hour, and also please do submit your own questions. You can see there's a questions panel there, and I'll try and get through as many as I can towards the end of the discussion. We're here today to discuss the ways in which digital identity will act as a catalyst for the transformation of the healthcare sector, and in particular how the current pandemic, the spread of COVID-19, has accelerated this. We've got a top panel of experts to talk you through all of this afternoon. I'm going to start by asking them to introduce themselves. Husayn Kassai is Chief Executive and co-founder of Onfido. Perhaps you'd like to go first.
Of course, great. It's good to be on. And as you mentioned, Zoe, I'm one of the three co-founders and the CEO at Onfido. We set up the company 8 years ago, and our focus is around identity verification. So especially in the times of COVID-19, we are a remote identity verification company in an increasingly remote working world. And our approach is to take a photo of a government ID and a short selfie video of the people who are registering with businesses that we service. And then behind the scenes, we're assessing if those IDs seem genuine or fake and matching the person's face to them. And there's a lot to talk about when it comes to healthcare, so looking forward to the discussion.
Thank you very much, Husayn. And next up, we've got Paul Meyer, who's Chief Executive of the Commons Project. Welcome, Paul. I think you might be on mute.
Unmuted. Great. Thanks, and thanks for having me today. So I'm Paul Meyer, one of the co-founders and CEO of the Commons Project. Spent the last 20 years building basically digital health services around the world. Sold my company 2 years ago and launched the Commons Project as a nonprofit public trust out of the Rockefeller Foundation, because we really believe that technology is a transformative force in society, yet there are certain services that are basically public goods, and we as a society need a structure to build and scale and operate basically digital services for public good. And that's what the Commons Project is. We spent most of the last 18 months building Common Health, a platform for people to collect, store, and share their health data, the Android equivalent to Apple's Apple Health, and have been doing a lot related to COVID, but really focusing on the opportunity to build and operate a sort of shared platform, neutral platform. And we're particularly focused now on launching Common Pass, a platform to allow people to begin to cross borders in a privacy-preserving way.
Thank you very much, Paul. And finally, let me introduce Bryn Robinson-Morgan, who's Vice President of Digital Identity at Mastercard. Hi, Bryn.
Hi, Zoe. It's really great to be part of the panel today. So as you mentioned, I work for Mastercard. I work within the digital identity team. I've been at Mastercard now for 18 months, though I've many more years in digital identity and identity more broadly. Digital identity is really a passion of mine, so it's great to be working for an organization that shares that passion. At Mastercard, we believe that every individual in the world should be the owner of their own identity, and that they should be able to define it, protect it, and use it to advance their goals. Our team is behind the ID service, which we launched last year. It's a smart, secure, and convenient service for digital identity. We announced earlier this year that we're doing work in Australia and also in North Macedonia. And if I look at North Macedonia just for a second, here's a country that gained independence only in 1991. In March this year, it opened negotiations for accession to the European Union. So it's a country that's really going through transformation, be it social, economic, health, welfare, as well as digital. And with North Macedonia, it's using digital identity as a foundation for that transformation. It's a really exciting prospect. And at Mastercard, we're thrilled to play our part in that.
So before we go any further, I think we should start by defining exactly what it is we mean by digital identity, and specifically how we're operating in the current landscape. Bryn, perhaps we could harness some of your passion for the subject and ask you to kick that off.
Yeah, absolutely. So digital identity is the collage of data that defines an individual. So as well as things like your name, your address, your date of birth, it can also be expanded to connect other information about ourselves, such as our education, our qualifications, work history, and of course our health data as well. Digital identity is reusable, so it allows individuals to identify themselves to gain access to multiple services and to do that with speed, convenience, and security. And because the information within your digital identity has been verified, it allows the user to assert that information to others in a way that they can trust. At Mastercard, we've designed our ID service to allow the user to be the owner of their digital identity. And we store the user's details on their mobile phone. And that means that there's no big database. And this model is known in the industry as decentralized identity. Instead of a username and password, which we've all got hundreds of them and we can never remember which password we've used on which website, so we decided to use facial biometrics. And that's a subject that brings up a lot of concerns about privacy. But what we've done is we've actually stored that within the user's device as well. So as part of their digital identity on their mobile phone. And that way we actually maintain privacy. So if we think about our needs for identity and how that's impacting our lives, particularly at the moment with COVID-19, we're finding ourselves in a situation where people need to interact almost exclusively online. And that may be okay when we have a known relationship, though we're making lots of new relationships and we're establishing those for the very first time. So if you think about things like a remote health consultation, you would want the doctor to know that it was you before they actually started giving out your medical history. And also you'd want to be sure of who they were so that before you start giving them information about your medical condition, you know that they are the correct individual and that they are a doctor or a health professional. And there's a challenge around rolling out those new solutions. And I think it's been compounded because we don't have this simple, trusted method of connecting credentials such as your health data to an individual. So as we've witnessed this seismic shift in our use of digital services, although of course many of us are still craving those real world interactions, and the news yesterday that we'll be able to go back to the pubs from the 4th of July is something that's really great, and a lot of us can't wait to be able to do. But I think actually this move to a more digital society, I think it's going to persist. And because of the fact that it's going to persist, we need to make sure that we've got effective collaborations and partnerships so that we can design solutions for this new normal that will have a lasting impact. And when we talk about the new normal, what we'll see is how digital identity will unlock new and enhanced experiences. And it will change how we interact with each other and how we interact with businesses, with service providers, and with our communities as well. And technology will help us to reignite the economy and actually create that new normal. Paul, if I could bring you in here, I'm sure that you've got lots of practical examples that you can really bring this to life.
Great, and that was a great kind of primer to set the stage. It's funny, as I said, I've spent a lot of, I guess now a couple of decades now in sort of health technology world. And one of the challenges of health technology is it's primarily been built around institutions, right? We have hospital systems, we have insurance company systems, public health systems, and I've always said that the human being is the only central organizing point in the healthcare system. And the problem that plagues, I mean, this was a problem pre-COVID, during COVID, and post-COVID, that the way technology has been basically deployed in healthcare, it's been through these existing systems. And I mean, the US is probably just a most egregious example of this. I'll share a sort of historical anecdote. A congressman named Ron Paul in 1999 put a provision in an appropriations bill that barred the federal government from issuing a national health ID because he thought this would be a backdoor way to sort of a national ID and Big Brother and all the rest. But the consequences of that is it's been almost impossible to reconcile information about who someone is to be able to provide care. And so if we, the use case that Bryn was just talking about, I want to go to a telemedicine visit because that's the only kind of doctor we can all see now. Well, I totally agree with what Bryn said. Like, you want to know, they want to know who I am and I want to know who they are. But I also want to be able to be sure that their consultation, the advice they're giving me, is based on my information. But right now, my information is in all these fragmented buckets from this hospital system and that hospital system and so forth. And so what I really want to be able to do is pull that information together, basically say, hey, this hospital, you've got some of my records and this lab has some of my records. I actually want it all because when I go to that new doctor, even if it's a telemedicine visit, I want them to have the information they need about me. And that's been a huge problem because we basically haven't had a system for effectively an integrated kind of identity framework. And rather than, and this is why this sort of decentralized ID model is so is the only way that will actually make this whole model work, which is I need to be able to say, look, I'm Paul, and Weill Cornell Hospital, you may have me associated with this password ID login and Quest Diagnostics. You may think of me, but I'm the same person, and I want to identify myself once and for all. And for the purpose of getting all the information already about me and then sharing it, whether it's because I now want to go to a new telemedicine consult and get that telemedicine consult, whether it's because I want to now take the prescription that was issued in that consult and get a prescription filled, virtually, whether because I now want to get on an airplane. Well, I guess now Europe's not going to let Americans in ever again, so I guess I won't be getting on an airplane to meet you all in person, since we're now sort of forever personas non grata. But when I want to now go to get on an airplane to travel and cross a border, and I need to show it's me, I'm the one who had that negative test result, or let's play this forward. Let's look forward to the day when we have a vaccine for COVID-19. I'm going to want to say, look, I got vaccinated. Therefore, please let me come to England because I've got vaccinated. But I'm going to have to document that, hey, I'm the person who that vaccination, went into my arm, and I'm now the person, sitting at Heathrow saying, please let me into your country. And all of those, there's so many use cases. I could go on for hours with all these different use cases, but it all gets back to me being able to assert I am who I am, and drawing together all of these data that are existing data that exist, as well as all of these use cases that I actually may want to take advantage of going forward.
Thanks. I wonder if I could bring Husayn Kassai in at this point. What do you see, Husayn, as being some of the most pressing challenges that we're facing right now in relation to this in the healthcare space?
As both Bryn and Paul mentioned, there is a question around privacy and a fair amount of, I suppose, skepticism as to whether this could be done properly. Now, the best thing with technology is that the latest technology can show that you are able to, for example, prove a person is who they claim to be without having to share any personal information. And that's going to be a relatively important part to it. But for better or worse, it seems like we don't necessarily know how long this pandemic is going to last. Is it going to be 3 more months, 3 more weeks, 3 years, or 30 years? And so just the way that we are using the best that we have across the world to make advances on the science side with the medicine, and specifically having dozens of different labs running different vaccine trials. Some are already in production, even though later stage testing hasn't occurred. It's just that the importance of having a solution towards this is so necessary that there's strong progress being made. Equally, you also need to take full advantage of what technology could do and run a range of different pilots and trials around making progress on that front. So the healthcare data has already been covered. Contact tracing, as everyone is aware, is sort of a work in progress. Telemedicine, there's been strong progress. Even this morning on the news, Babylon Healthcare were sharing a bit about how they've seen a surge in demand, and you can go and use a sort of an online doctor where appropriate, and that is helping not just automate a lot of these processes, but giving access to more and more people than previously was possible. On immunity or health passports, that's an area that we are somewhat involved in. And essentially the way that works is you have an app with a healthcare passport, and that has a connection to a test result, which we're not involved with. And it somewhat depends on the accuracy of these test results. And then the second is connecting the app to the person's physical identity, and that's the role that we play, so that once you have this, you're not able to give it to a flatmate or a sibling. And that's another example of bringing the best of technology and the best of science to help us make progress. And it's an example of where you could try more proactive measures to help get life back to normal. Because as you know, contact tracing and a range of these other initiatives historically have been geared towards being reactive. And given the nature of this disease and it's being asymptomatic, there are many benefits of trying more proactive approaches too.
Thank you very much, everyone. I think that's a really good, comprehensive introduction to the subjects that we're going to be discussing today. You know, lots of challenges there, lots of need for change. We need to get Paul over to the UK. We've got to work out how best to make that happen. I wonder if we could kick off this next stage of our discussion by looking at what we think the lasting impact of COVID-19 is going to be on the update of digital solutions in the healthcare sector. What are we going to see, and what can we learn from what's happening now?
Well, I can start, and I can pick up on Bryn's point earlier. I mean, what we've seen is this massive acceleration of. I mean, we've since the mid '90s we've been on this gradual transition to a digital world, and all of a sudden it just exponentially accelerated over the last 3 months. It's true in healthcare, it's true in e-commerce, it's true in kind of every aspect of life, and I don't think we're going back. I mean, certainly, again, we will begin to sort of have some social interaction, but ultimately, a lot of these things, certainly in the health industry, that obviously is the industry I pay most attention to. I don't think we're going to pine to go back to spend time waiting in doctors' waiting rooms when we've realized, oh wait, you can actually, for many things, you can do a video consult and it's just as good and you can stay home. So I think we've just seen a massive acceleration of trends that were underway. But I think what's interesting, and I think you can see the same thing in schools. I mean, I've my kids just finished 3 months of relatively ineffective Zoom school. I think what you're seeing in industries is whether it's healthcare, whether it's education, these traditional models that are kind of brick and mortar centered models aren't very good at embracing a digital first world. I mean, they're struggling. I mean, my school did a pretty good job, but that's very different. I mean, by definition, institutions that are wedded to their own traditional models aren't the ones that are going to come up with the disruptive new models. And they're not going to be the best because they're so wedded and invested in their existing operating structures. So I think it's a really, I mean, it's obviously a horrific time for the world, but it's a very disruptive and time of opportunity for new models, especially sort of digital first models that aren't and again, I've spent the last 20 years building mobile-based digital health services around the world, and I feel like it's finally now the moment for that model to come into its own, because the reality is there are close to 6 billion cell phones on the planet, and there's really no marginal cost of offering digital services, which ultimately means you can think about offering some sort of free universal services for everybody. And then think about the expensive things like medicines, doctors, machines, buildings as the things that are exceptions. I mean, there's been a lot of talk for years at the UN and elsewhere around universal health access and universal care. it's been this sort of pipe dream. We should have universal healthcare by 2030. But pre-COVID, I mean, the mindset has been, we need clinics everywhere, we need community health workers everywhere. And the reality is we'll never get there with 9 billion people on the planet. But if we kind of recast that and say, well, you can probably do a pretty good job if you think about, universal digital first health, make that universal, and then say, all right, if people need, let's make the expensive brick and mortar healthcare system the sort of escalation path rather than the default baseline. So I think it's a very exciting time, and it just COVID is just serving as an accelerant and a catalyst to basically push us, I don't know, 10 or 20 years farther, more quickly down this transformational path that we were already on.
And big tech has come out and said that too. Brad Smith at Microsoft said he thinks that we've seen 2 years of sort of digital transformation take place in the last 3 months, just because people haven't had a choice, have they? If you want to see a doctor, you've got to use telemedicine. If you want to speak to your family, you've got to video call. But the question is how to keep that momentum going. I mean, Bryn, what do you think? Do you think that this is the lasting change that we're seeing now culturally?
So absolutely, I think that the changes that we've seen will absolutely persist. I mentioned earlier that we will want to get back to physical interactions, and as human beings, that's how we are. But I think that Paul made the point about organisations that haven't been able to embrace digital, haven't been able to move their service offerings online. They're the ones that are really struggling. It's the organizations who have been able to adapt that have fared best throughout this crisis. And that, I think, shows that organizations need to create partnerships, they need to create collaboration so that we can actually do the best for the individual and make sure that people aren't left behind. So again, Paul's point about the universal digital healthcare, from a identity perspective, we've got organizations who know us really well, that we interact with on a regular basis. And then we've got other organizations who we either don't have a relationship at all, or have got a relationship that hasn't got a lot of knowledge and a lot of trust between the parties. So if you think about a healthcare provider, your GP, your regular physician, is the person that you will have that trust with. But if you need to go and get specialist medical care, and you need a consultation about a special problem, then it's how you can create that trust across that boundary. And that really is the challenge. Within our ID service, we have a role called a trust provider. And the trust provider is who the user chooses to have that relationship with. So it could be your bank, it could be your university if you're a student, or it could be your GP, your primary healthcare provider. By enabling the individual to use that trust, but to pass it into another context, that's where we can start to get the lasting change and make sure that we do have that fairer society. So if I'm an individual who knows my GP really well, I should be able to leverage some of that trust so that if I did want to open a bank account, the GP's assertion about my identity could go into that process. Similarly, if I'm a university student, I've got a really close relationship with the university, but I might not have much of a digital footprint. So I could leverage that trust from the university as a way of getting access to my healthcare records.
Husayn, what do you think are the key lessons that we can learn from this very strange moment in time, and how can we take those forward when this sort of recedes?
There are two. One is how adaptable we can be as humans if we need to be. And second, that there are so many efficiency benefits of moving to a digital world. So picking up on what both Bryn and Paul said, if there were to be, if there's a good parallel example, if you rewind 12 or 15 years when we first started to see self-checkout tills at supermarkets, at first it was a bit awkward and most of us didn't like it. But after a while, we started getting used to it, and now most people prefer it because they know what to expect, and it's sort of usually there's a shorter queue. And similarly, getting used to online communication tools like the one we're using now is becoming commonplace. So it's hard to see, once people have seen the benefits of having a video call, to go back to face-to-face meetings where they can sort of save themselves from going through those. And healthcare and telemedicine and things of that nature are relevant in that healthcare historically has been face-to-face. You know, you associate it with going to your GP, it's kind of a normal thing. Whereas now, the hope is that the norm is shifting to show how it can all be done digitally. And as a result, it broadens access to more people, and it enables it to be delivered in a faster way, especially as we're increasingly working in a remote world. Now, there are different building blocks that are needed to make this digital healthcare provision possible. And naturally, as Bryn mentioned, identity is a component of it. Just so that if I am accessing an online healthcare provider and they need to pull my health records from a centralized health service like the NHS, then the health service provider needs to know that I am me and I'm not claiming to be David Cameron, for instance. So these different building blocks, as the sort of smartphones get better and as access to those get better and the building blocks can come together, it will hopefully be a thing that permanently will stay with us.
So the other thing I would throw in, I think the other dimension to this pandemic and this moment we're in is that we're sort of all in this together. And it's funny, in healthcare, there's always been this traditional divide between sort of public health and healthcare. Certainly in the US, you know, healthcare spends $3 trillion. You know, public health cares about everybody has no money. Healthcare spends $3 trillion billing for doctors' visits. That was sort of the traditional separation, right? And healthcare was all about, you're my patient, you know, I'm your insurance company, and it's a very sort of boxed in relationship, whereas sort of public health is everybody. We've all learned, if we have learned nothing else in the last 5 months, is that public health matters and that we're all together. And that the virus doesn't respond to, you know, respect borders of like, who are you an employee of, what, you know, what kind of passport do you have, even what country you live in. And that we actually need, there are some of these problems actually need collective solutions. They can't be solved within the sort of institutional or even frankly geographic boundaries that we've traditionally relied on. If you go back and think about sort of technology and the internet, right? The internet was this sort of public utility. I mean, funded originally by the Defense Department, but we'll leave that aside. But we basically, and then we set up ICANN, which was the sort of the governance model for naming and numbering. But we then sort of said, hey, everything else we're going to leave to the private sector to build all the stuff on top. And what I think we're realizing is there are certain common services that really are universal common services that effectively are shared public infrastructure. But we as a society, we really haven't figured out a model for doing those things. The reality is, governments, there are certain things that governments can do, technologically, but there are services like, for example, the sort of passporting, border crossing use case that by definition have to exist between countries. And but they're really fundamentally public goods. I think of it as the equivalent of public infrastructure for the digital era. And so I think we're here at a moment where the world is saying, hey, there are certain problems that we actually need to be solving collectively. We need platforms and services that actually cross borders. But then the question is, well, okay, who's going to do that? Because I don't think we want, Facebook to control our, digital health passporting thing, right? And so I think there's some really interesting questions, and that's obviously what the Commons Project is all about, is saying, hey, what are those services that are fundamentally digital public goods that actually need to operate on a cross-border basis, and how do you do this? But I do think, in a more hopeful, lens, that there is this recognition that we're sort of all in this together, and we need to be thinking about cross-border solutions. I was on a phone call with people from China the other day, talking about travel and reopening of borders. And I think what you're seeing is a lot of countries are starting to think about, okay, well, China has started to let people from Korea in if they've had a recent negative PCR test. You have all these quote unquote travel bubbles opening up, right? Everyone's, Australia, New Zealand are talking about, okay, let's open up a bubble between Australia and New Zealand, for example. But ultimately, people from China are going to want to go to New Zealand, and people from New Zealand are going to want to go to, Morocco, and people from the US are going to want to go to the UK. And if everyone is building their systems in their little bubbles, ultimately the bubbles are going to have to connect. And so I think this is certainly it's what we've really been advocating for is, you know what, we actually need a common global framework for this, that if everyone is operating in disconnected bubbles, and so I just sort of share that because I think there really is a recognition of a need for kind of common shared solutions, and that the traditional models of, oh, I'm doing it for this government or for this healthcare institution or in these existing institutional stovepipes, that model actually doesn't deliver the kinds of solutions that we need to, you know, meet the needs of the moment.
I think that's a really
Yeah,
interesting point, actually, Paul, because pre-pandemic, there was a lot of chat about things like social media regulation and whether it should be a global effort. And if it is going to be a global effort, who should do it? Should it be the UN? You know, should it be Europe and the US and China doing their own thing? Who should sort of oversee this all? And there was never quite the momentum to get a real discussion going. But maybe this is the moment where we do need some sort of global data organization. Bryn, what were you going to say? What do you think?
Yeah, so I was going to agree very much with what Paul said. I think for digital identity, it is that foundational layer, and it should be part of societal good. One of the first things that we did at Mastercard was we actually published our principles for what we believe good digital identity looks like, and we've made sure that when we've been building our service, we've built it to adhere to those principles. We published them, we made them available, we spoke to various people within industry. The other thing that we do is we often talk to governments as well. So there is a real challenge to get to that collective agreement. So what one government would recognise and accept, the way that identity works in the UK versus how it works in China versus how it works in Australia. They've all got slight nuances between them. Sometimes they've got quite big differences. So the importance is to be able to have that interoperability. It's not that you need one single way of doing identity. I think if we try and do that, we'll really struggle to get to that point, because as US citizens, things that are acceptable or unacceptable to a Chinese citizen could be the complete opposite. So we need to make sure that national interests are taken into account, but also that we have that interoperability between them. So if I've got a good level of identity in Australia, it's also a good level of identity in the US. It's also a good level of identity in the UK. We really need that interoperable framework rather than a single way of doing identity, and also the credentials that are associated with them.
Yeah, just building on that, I mean, I completely agree. And I think, you know, many of us have been sort of evangelizing for that for a long time. The reason that I'm so actually optimistic now, really stemming from the work we're doing around Common Pass, and we're doing this in collaboration with the World Economic Forum, is because every country really wants to figure out how to safely open their borders because their economies are paralyzed. So all of a sudden you have every country, and we're in dialogue with every governments from the US to New Zealand to Japan to Bangladesh to Kuwait to Jordan to Rwanda to actually the whole East Africa community. And we're basically, Bryn, you're absolutely right. In ordinary times, they think it's identity, it's my thing. But when you actually present them with the use case of, well, wait a second, I mean, take Dubai. Like Dubai airport has people flying from every country to every country. You just can't, the model fundamentally doesn't work unless it's an interoperable model. So this, this use case that, we've been working, around Common Pass, it is very compelling because they can't even, even China can't say, oh, we just want to, make a China only thing. Well, guess what? Because you want people from other countries to come into China and you want to let people from China go to other places. So by definition, to support that border crossing, I mean, there are lots of people talk about immunity passporting and I want to go back to the concert hall or, go to the grocery store or whatever. and there are all sorts of issues there. But if we just stay focused on this international border crossing use case, countries all recognize by definition it can't be a sort of hermetically sealed national ID. It's got it. So I think the opportunity to demonstrate this kind of an interoperable model in the context of reopening borders in a harmonized way is the use case that you and me and many others have been sort of waiting for, to demonstrate that the need for a basically kind of cross-border transnational sort of trust framework.
So we're bringing this round to travel, which is, I think, a really good way of looking at some of the challenges here. But let's bring it back to healthcare for a second, because of course one of the biggest challenges is data privacy, isn't it? How can we ensure that we are respecting patients' data privacy at the same time as we're sharing all of this information? Husayn, perhaps you'd like to kick off.
Sure. So when you ask people about what is of interest or what's the area, what is of concern, most people don't necessarily worry about the health authority holding your personal information or your health records just because they have done so since your birth in most cases. What they are uncomfortable with, rightfully, is when that private information is shared with others, especially in the context of, there are many, but let's just say insurance or your employer. Do you want the insurance or the employer to know you have a sort of a specific condition or health condition, for instance? So when you understand what the issue is, it's less about there being an authority that is trusted, like the health service, holding that data. It's more around what is shared. When you get to that understanding, then it becomes a question of if we sort of go back to health or immunity passports, if that is a program that is going to eventually come about and be rolled out, the importance of that just being a yes/no on your health status is crucial, so that you're not sharing any more information. It's just a case of, does a person seem to have had the virus and has now recovered, or has the person had a test to suggest they don't have the virus right now or today, and therefore can act more as a day pass. But thirdly, it doesn't necessarily have to mean that every organization has the right to see that from you. It can be, and certain models are moving in a direction where it's only certain pre-approved organizations can ask and request that information. It's just the hospitals, care centers, or maybe airports, maybe they should have the rights to request that and have that checked with the central health authority, give a yes/no on this person's test results, so that you don't have the other sort of potentially more contentious or risky scenarios.
Bryn, you're nodding along there. You agree?
Yeah, absolutely. I think the points that you raised, Husayn, are really, really important. So healthcare is a really charged debate, and we need to make sure that we're taking the highest standards of care with that sort of data. So with COVID-19, if somebody has had it and they can get proof to say that they've had it, that they've got antibodies, that would probably be seen as a bit of a badge of honor. It would be the thing that you would happily show down at the pub to say, hey, look, yeah, I've had COVID and I've survived. But we know through the years that isn't true of all medical conditions. We've got discrimination that still takes place because of the medical conditions that people have. So the point that Husayn was making about we need to make sure that the organizations that are asking that question have got the right to ask for that question, and that they have obligations as a result of that right. So once I've shared a piece of data with an organization, I can't take that sharing back. Somebody knows that information when I've told them it. So we need to make sure that we're creating systems that have that privacy underpinning it. It's got to be privacy by design. It can't be privacy as an afterthought. And jumping quite a way back, Husayn, you were saying about people using Zoom for the first time, and we think about I work in technology. I know how technology works, and the number of people that ended up getting Zoom bombed because something had shifted. The number of people using Zoom had had exponential growth. And so the code that allows you to access a meeting, it was secure, it was perfectly acceptable, but all of a sudden you could type in pretty much any code and end up in a Zoom meeting. So we needed to make sure that we were using passwords and not sharing the link on a public forum. But so many people that are working in our industry that are smart, bright, intelligent people, understand technology, were still making those mistakes and were still suffering the consequences of it. So with healthcare data, because of that sensitivity, it's got to absolutely be secure. We need to know, without having to understand all the complexities of it, who I'm sharing that with. They're asking for my information. I need to know seamlessly that I can share that information.
I think you're absolutely right that you only get one stab at that, don't you? You know, everything is private until it isn't, and once that cat's out of the bag, then that's it. I mean, are we able to make that promise? What do you think, Paul?
Yeah, I mean, that's what, I mean, fundamentally, if you look at the way Apple Health is architected and Common Health is architected, it is literally, first of all, you aggregate your data, you're in control of it, it sits on the phone. Where it then says, hey, so-and-so wants to access this information, or to Husayn's point, ask this question. I mean, these sort of passporting use cases, you don't hand the data over. You just say, okay, if I want to fly to Hong Kong wants to know, have I had a negative PCR test in the last 72 hours, yes or no? It then queries either Common Health or Apple Health and says, hey, does Paul have a lab result in his personal health vault that basically matches that criteria, yes or no? So, I mean, first you design the use cases so you don't actually hand the data out, because, you know, then it's, you know, out of the bag. The other, so complete agreement with what, you know, the other two panelists have said. I think that the thing that, again, because, you know, we were obviously working on this long before COVID came along, I think, and there's now this like COVID tech boom. Everyone's all of a sudden COVID tech. Who knew this was going to be the new like growth industry in the tech sector? I think it's really important in building out these use cases to meet the urgency of the COVID moment that we actually do that in such a way that builds the foundation, helps our society move towards a scalable, sustainable digital health world. And it would be classic to build systems that are COVID passports, or, you know, use cases just around COVID. But ultimately, this ability to get my health data and decide, be able to be given control to decide who to share it with and what to share or what not to share, is something we need in our regular lives, not just in our COVID, I want to go back to the pub or get on an airplane lives. And so I think it would be a huge, worse than a missed opportunity, would set us so far back if the urgency of COVID led us to solutions that weren't architected to basically be able to support our custody and control of health data for our health, not just our desire to, you know, go to the pub or get on an airplane. So just a little bit of a caution of not getting so single-mindedly focused on the COVID. Oh my God, we've got to get a COVID thing going, that we do it in a way that isn't actually accelerating. And I think there is a great opportunity, because I think what it's funny. There's a guy named Peter Newport who led Microsoft Health when Microsoft did Health Vault about a dozen years ago. And I don't know if you may remember, Google Health and Microsoft Health Vault, 12 or 14 years ago, tried to do these sort of digital personal health record platforms, and they both eventually, kind of failed. And I was talking to Peter, he's one of our trustees, and he was sort of sharing the lessons learned from the Microsoft Health experience. And he said, after all the millions of dollars and all the research and all the things we did, we realized the only reason that people actually wanted a personal health record was to get their kids' immunization records to register for school or summer camp. And, because most people don't wake up on Saturday morning saying, God, I wish I had all my health data aggregated in the cloud, right? That's just not a sort of, deep human need. What this moment is creating is, the reality is ultimately all of us are going to need to document our own vaccination status to do lots of things. So in some ways, that use case of I need my kids' immunization records to register for school is all of a sudden a use case that's going to become near universal for some time to come. And so I think it's, the way we think about it is We want to sort of meet the needs of the moment and support that that urgent use case, but do it in such a way that ultimately accelerates this transition and allows people to have the right that we've all had for a long time and should have, which is the ability to collect, control our own health information because we need it to live our lives.
While we're on the subject of COVID tech, which, by the way, I think I'm going to steal. I like that phrase a lot. Let's talk about how digital identity might apply to things like contact tracing, which I seem to spend almost all of my time talking about at the moment, and telemedicine. What are your thoughts about that?
So I think that there's been an awful lot of debate about centralized versus decentralized systems. There's been a lot of embarrassment around that, and there is always this public health versus privacy debate. So what information should I have to give out versus what information shouldn't people be able to ask for? And I think that we can probably fill a whole webinar debating around that. If we bring it back to digital identity itself, I think that the point that Paul was just making absolutely lands this point, that the reason why we've rushed to get a contact tracing application out is because we don't have the foundational infrastructure in place. We don't have a digital identity infrastructure in the UK, in the US. There are a few that exist around the world, but there aren't really any that operate at scale globally with interoperability. So all these things need to happen. If we can find the courageous leaders that are willing to collaborate and are willing to say, I recognize this immediate need, but that's not for me to solve. What I can go and solve is to say, I will get involved in the longer term solution and meet my longer term needs. The number of times that I've heard people come up with a solution and then say, but this will only work if we've got identity and if we know who people are. And I think the contact tracing debate would be completely different if we'd got that foundational digital infrastructure in place, with identity being a key layer of that.
Do you agree with that, Husayn and Paul, that if we had digital identity, we wouldn't be in this mess that we're in now?
I think that of the countries that have been able to make progress faster, China is one. They have an ecosystem that wouldn't be rightfully palatable outside of China because there's zero privacy. Now, the great position we find ourselves is that technology exists to enable a Chinese type model on the good side, but without all the downside of any organization, be it government or big tech, holding or having access to anyone's personal information. So our stance is that there shouldn't be any organization that holds your personal information, especially when it comes to identity. And it really ought to be stored and controlled by the individual themselves, but done in a very easy and frictionless way, so the individual knows that they are able to own and control their own legal or real identity and just give a signal and provision access to all the organizations or governments and others that they want to do so. That, in our view, is the way forward that helps you get the best balance between both privacy and security, but also access at the same time.
Right, we are coming towards the end of this session. My goodness, it's gone so fast, hasn't it? I'm just going to try and zip through some of the questions that we've been sent from everyone who is watching. Thank you very much if you've sent in your questions. The first one, what is the role of private identity providers in countries that have well-established state-guaranteed identity? For example, countries with ID cards that have a unique numerical identifier. Bryn, would you like to start?
Yeah, sure. So as I mentioned earlier, we know that there are different identity systems around the world, and if you have a centralized register of identity, then that can work nicely within that country, and that should absolutely be part of a digital identity ecosystem. The role of those countries is to actually get into that interoperable ecosystem and also an extensible ecosystem as well. So for a national identity card, not all of them are digitally enabled. So there's that challenge there. How do you make that credential usable on the internet? But also, how do you then allow that to be used across boundaries, so that a country that doesn't know about an Estonian EID because they operate in the US, they should still be able to accept that and understand what level of assurance, how confident they can be in the identity that's behind it. So that interoperability piece, the digitization piece, but also the fact that it can be extended so that it can contain other credentials as well. So it's not just a photo, a name, and a date of birth. It can be extended to health data, to qualifications, all the things that you need to be able to prove in your digital life.
I want to bring in another question here before I throw it to you, Paul and Husayn, because I think it's relevant. Somebody's asking, is there scope for a standard that will let these things work interoperably together? Is that what's missing here?
Yes, so a standard can help. And so first to answer the piece around state-issued IDs. Both the Indian example is the largest one with the Aadhaar card system. There's a Turkish one, there are a whole host of others. The challenge is that they've been breached. So even though in India you can check someone's Aadhaar card number against the central database, UIID's database, there are two problems. One is that most fraudsters create a fake ID, but they're using a genuine Aadhaar card number on there, so that even when it's cross-referenced, the check passes even though it's a fake ID. And the second challenge is that, again, given that it's breached, the value is not there as much because you're not checking the ID image against a centralized database. You're checking the ID number, which is a shame. And it could be improved if there were actually a way to check the actual image and whether the image is genuine versus just an ID number. And whether this, as on the sort of value of standardizing this, it holds. And Facebook has standardized the way we share our social identity. LinkedIn has standardized the way we signal our professional identity, and there is a need, it seems, to standardize the way people share their legal identity, or at least prove that they are who they claim to be and their sort of date of birth, name, address specifically. And that will only really come about when there are more organizations working in collaboration, especially government and regulatory ones being involved, so that you can see the benefits. And there are a range of different schemes, as Bryn mentioned. Across the European Union, there's EIDAS, for instance, that is limited to public sector, and there are a few issues there, but it is one step in the right direction. And our view is that in the next 5 to 10 years, you're very likely to see the emergence of standards to essentially assist with this interoperability point, so that ultimately users are able to access different services in a much more user-friendly way. I mean, it took almost 50 years ago, we went to the moon. So how hard is it to get a simple device to know that it's me, or for me to gain access to different services without having to go through so many different hoops?
Paul, final thought from you briefly, please, if you could.
Yeah, again, I'd say, Bryn and Husayn are much more closer to the sort of digital ID standards world than I am. I just would offer, again, this use case of border crossing. It's a use case that requires interoperability, and it requires countries to accept this person that wants to come across my border, that I know who they are, and I trust the health information that they're claiming and asserting is valid, right? So solving for that use case, by definition, it has to be interoperable, it has to be standards-based, and it actually has to fuse together identity and health data to support a very simple thing, which is there a trusted, scalable way for someone to say, hey, I've had a negative PCR test in the last 48 hours, or I've been vaccinated for COVID. So I just think, again, there's an opportunity here to actually prove the model with this urgent global need, but ultimately to really demonstrate a new model, both for the identity world that Bryn and Husayn are deeper in, as well as the health data world that, where I've spent my career.
Thank you very much. I think we're going to have to call it a day, I'm afraid. It's what a fascinating discussion. I've certainly learned an awful lot this afternoon. I'd like to say a big thank you to our panellists, Bryn, Robinson Morgan, Paul Meyer and Husayn Kassai. Thank you so much for joining us. And if you've been watching, thank you very much. I hope you have found it as educational as I have. Please, thank you also, by the way, for sending in your questions. I'm sorry that we couldn't get through more of them, but we did get through as many as we can. If you want to, you will be able to download this whole chat. It's all been recorded and you will be sent an email link so that you can download it, watch it again. Please remember, you can feel free to tweet anything you've heard and do get in touch with us and let us know how you found it. Thank you so much for joining us all this afternoon. Thank you.
Thanks.